So.
Busy all bloody morning, haven't we? Oh. Good afternoon, everybody. People must be keen. It's not even 1 o'clock yet.
And I'd say good morning.
This is always a good sign when people are joining meetings early. Either that or they just want to get it out of the way and crack on with the work.
It's when it pops up to say somebody's joined, like prompts you to join yourself.
It does. So come on, who was first to join? That is the question. Was it you, Kay?
No, it wasn't me. Not me. I heard a bleep.
She didn't put it on mind.
Claire hasn't. Yeah. If she doesn't, then we won't.
Yeah, she can't rule one for the other. You know?
Absolutely.
I don't know what that was about.
I'll just give it a minute. Let everybody join.
Keep looking.
Yes, because we're very early. We might be just finishing up our lunches.
Just to let everybody know, we are recording the session, but it is just for people to be able to view it afterwards, or for those who might not be able to make this session. I will put the link to the YouTube video once it's uploaded to YouTube into the shared drive folders. You will notice there is some links in there already from previous meetings, if people do want to look back at previous meetings.
Thank you, Tracy.
We can, if people are struggling to find their way to things, we can show you. We are aware the shared area on the DWP SharePoint site, it has got quite a lot of stuff in there, but there are quite a lot of empty folders as well. So we are aware of that, and we are looking at how we shift everything around just to make it easy to find things. You know, we want this to work for you lot, and I would appreciate any feedback from people who are using those folders. If you want it in a different way, or you want to see it in, you know, different things, you need to let us know so we can make it work for you lot. Okay, right, I'll make a start now. It's 1 minute past. So what I just wanted to do is say thanks again, everybody, for joining. We always have a good turnout. I know people don't like particularly putting the cameras on, and that's fine. It would be nice to see some faces. However, don't worry, I'm not going to, bend your arm up your back to force you into it. And I know some people's internet sort of access can be affected if you have your cameras on. So, but thank you for those people. Oh, lovely, nice
That
to see
little
you.
wave there as well, Tracy.
Super duper. I just want to do a quick recap on last week's meeting. I'm hoping, hang on, before I go on, is there any new people here today? If you just want to put your hand up. Is there anybody who hasn't attended one of these meetings before, apart from Jill? Obviously, Jill, who I've one of my people who I've invited in. Oh, there is a few people. Okay, lovely.
There's lots
Great
of new
stuff.
people.
Yeah. Oh, that's great. Super duper. Okay. Before we move on, then I'll just recap on what this meeting is all about. We set this up as part of the support group to support you as patient advisory service advisors or work well coaches or health and wellbeing coaches, anybody in that kind of forum who are supporting the health and growth accelerator work. There's so many of you out there. We wanted to give you a bit of a platform and a bit of a group, somewhere to come, see people's faces, see similar people who are in similar positions as you, and be able to share best practice, be able to talk openly about any issues that you're finding or learn from other colleagues. Really just to spread it across as far and wide as we can. So Kay and I, obviously for those of you who don't know Kay, Kay's from DWP, she's the regional lead. My name's Tracy, I'm from the ICB, I'm sort of the workforce development, and together with other partners as well, we've sort of created this group, and it's been really well attended. So thank you for joining, and please use those as much as you feel you want to. We're here to share information, disseminate information, to make your lives easier. This is about you. It's not about us. This is about you out there doing the doing, working with your patients and your clients. And if we can make things easier for you, we will certainly try our hardest. Okay, great stuff. So what I want to do is recap just briefly on last month's meeting even, and Happy New Year to everybody. But also I'd like to introduce a colleague of mine, Jill. Jill is from Northumbria Healthcare Trust. She's a public health consultant, and she's come along to this meeting to find out, more about us. But also she is doing some work around reducing barriers to patients and clients. So I'll bring Jill in after I've just recapped on last month's meeting. Okay, thanks for joining, Jill.
Pleasure, nice to see everybody.
Okay, so just last month then we went through a list of things. We had a bunch of people come in and talk to us, so it was quite a action-packed meeting, lots of information, and I appreciate trying to digest some of that information can be difficult. So we had Helen from Pillar 1, which is Pillar 1 of the Health and Growth Accelerator. She came along to talk to us about the an overview and the operation of the Waiting Well, sorry, I'm reading off a sheet here, the Waiting Well programme. So she talked through about the operating model, some of the stakeholder collaboration that we've got going on across the system, how they identify patients, the different support pathways that we've got in place, which I'm sure you at Frontline there will be starting to get to learn more and more about these support pathways and referral routes. She talked about the referral processes and some of the access, and then the offers and the patient engagement. Again, I appreciate we're a big region and things will happen differently in different parts of the region. And again, that's where we can sort of cross-fertilise best practice. We feel like that probably works well. We had a colleague, Hamdi, who came from our research and evaluation team. He wanted to tell you all and talk to you about the evaluation framework of how we're going to evaluate all of the work that everybody's doing, because it's important that we show and gather evidence and show that the difference that everybody is making, and make sure everybody feels valued in that process. So he talked about the data collection methods, the importance of the data quality, of what data you're collecting. Again, stakeholder involvement, we can't talk about that enough. Stakeholder, and meaning you lot, is absolutely vital, and just sharing that knowledge and the continuous improvement. We then had Craig from the MEC team, Craig Robson, to talk about some of the innovations and how they're planning on improving the MEC gateway, talking about the platform enhancements, the increased activity for public access, the intelligence search and data reporting, how that's improved, and we now will be able to collect data on who's referring to what and where from. The planned integration with other systems and how we can talk to other systems and share data there, and some of the training and support that's going on across the system. We also had Darmad from Northumbria Healthcare Trust talking about the MSK myth-busting sessions. I hope some of you managed to get to the one in December. I do understand, you know, I appreciate the timeline was very short in letting you know about those dates. So if people couldn't make it, I understand the session was recorded, and I'm hoping that Darmad will have shared that with Hynenk or Kay to upload it onto the SharePoint area. Yeah. So hopefully that'll have happened, but I think there is other sessions being put on into this month and next month about the different resources that we've got there for MSK. We've got we had a lady called Sarah Miles from the Help Force organisation, which is a volunteer to career charitable organisation. She sort of just briefly introduced herself, and I know Sarah has connected with DWP colleagues around how we can signpost people, particularly people who are coming to the DWP PAS advisors and the work coaches, if they're interested in volunteering with a you know a potential to get them into a new career. So I think that was everything from last month's meeting. There was a couple of actions there, and I probably need to chase them up, but I just want you to be aware, or acutely aware, that, you know, resources are tight, capacity is tight, so we don't always, I haven't followed through on a few things, but I'm hoping to get things sort of pushed through this month. I know December was quite a busy month, especially a lot of mobilisation was happening, new staff coming into post, new staff learning the ways of working. So please bear with us, and we'll continue. So without further ado, has anybody got any questions on last month's meeting at all? Do you want me to signpost anywhere at all? No. I'm just trying to think. One other question: has everybody got access to the DWP SharePoint area? Kay, have you? You wouldn't have a link that you could put in the chat for me, could you?
Yeah.
Lovely.
If you
Thank
don't
you.
have access, let me know. If you put your email address into the chat, and I'll get Steve on my team, or somebody else on my team to sort that out forward.
Lovely. Thanks, Kay. Okie dokie. So a lot going on there, and like I say, use that SharePoint area, because that's where we're putting the information, that's where we're putting any notes and things like that, just for people to catch up. If you know, when it can be difficult trying to remember and capture all information all at once about what is going on across the system, so we appreciate that. Okay, I'll come to Jill. Jill, do you want to bring yourself in and introduce what you're planning on doing, or
Hi,
part of?
Tracy, how long do I have? Because I have
You've got
sorry.
20 minutes, Jill.
Oh, brilliant. Yeah. Tracy, I've got a few slides that were developed for a trust audience, but I think it'll help me explain sort of the area of interest stroke, what the health coaches and PAS advisors might be able to support with. So would it be all right if I just share them?
That'd be lovely. Okay? Yeah, lovely. Thanks,
so I'll
Jill.
just I know you've introduced me, so hello everyone. So I'm Jill, and I'm a public health consultant at Northumbria Healthcare Trust. Our trust also hosts regional MEC, so I think there's a link with what you've already heard in previous meetings about making every contact count. So I'll probably bring the two things together if I can. But I approached Tracy and Kay because I was interested to hear about your roles and also about the types of conversations you have with the public, because obviously your focus is on supporting people back into work and understanding any barriers from a health point of view. And as a consultant in public health that sits in an NHS trust, I'm really interested in if any of those conversations are about how people get to their secondary care hospital appointments, and if people have any barriers or worries that might prevent them getting their health care, and how maybe your role can help raise awareness about that as maybe an issue, and how you could maybe tell us in the NHS about any problems so that we can think about solutions, but also making sure that you're aware of all the help that we're trying to put in place so that people can be supported to overcome the barriers. So I'll just share a few slides that give you a little bit of an awareness of what we've been doing at a hospital trust organisational level, and then it'd be really interesting to sort of hear your thoughts and just any ideas, and equally what you need from me and my colleagues, because there's people in all of the trusts across the North East that are working on this type of agenda, which very much sits within health inequalities, and that's about people who have different health outcomes because of things that are not necessarily their fault or something that they can do something about. So I'll find the slides and then we'll hopefully have a conversation. Let's see if I can get them up. So ones. Tracy, are they showing on the screen?
Yes, not in slideshow view, but
I'm
yes.
trying to do that now. I've got things. Has that worked?
Yeah.
Is that looking okay on the screen?
Yeah,
We can
just-
see it. It's just not in slideshow view. It's just
Oh.
in, you can see the slides down the side.
Let's have a look.
Little wine glass at the bottom. That's what I always look for.
Is that better?
Yes, that's better.
That's it.
Excellent. Okay, so this is slides that we're sharing in the trust, because the trust itself has got to do things to improve this as well. So this is my story that I'm talking to the organisation about. So you're a new audience for this, but it'll be interesting to hear from you. Okay, so we're talking about people getting to the hospital appointments, and I've used the word navigation. And it's about how do we help people navigate the health and the care system, because we know that the health and care system is actually very complex. We know that attending hospital appointments, so you've been to your GP, the GP and yourself have decided that you need some support from a hospital. So it's really important then that you get that care that somebody and yourself have decided you need. But we know that not everybody gets to their appointment. We know that there's rising health needs in our population, so there's more chronic disease, there's more long-term conditions, and we call it multi-morbidity. So that's where you've got more than one health condition. And if you've got more than one health condition, often it means that you're having to go to see more than one person in a hospital. Your care's quite complicated, so we know that that can be a reason for not attending. It's an issue for the NHS, because if people don't attend their appointments, it can lead to waste, but more importantly, it can lead to poor outcomes. So if people don't get the care they need at the right time, it can mean that their health gets worse, or it's more serious and therefore more difficult to treat. We also know that there's inequalities in who gets healthcare and who doesn't, and that's actually unacceptable, and that's why I'm really keen that we make every effort to address that inequality. So I'm just going to whiz through some of the slides. This slide is just about our legal duty. So the NHS has got a legal duty to address health inequalities. we can think about health inequalities in different ways. So it could be around protected characteristics, it could be about deprivation. There are certain groups who might experience health inequalities, so people who've got homelessness, drug and alcohol misuse, and geography, so people who live in areas that are more deprived might have more barriers than those who have got lots of wealth and assets and are able to articulate their health needs. So all of those factors affect health inequalities, and for the NHS, not attending appointments is a safety issue, and it means that people are more at risk of harm. So this slide, it's got lots of numbers on, and it's basically the story that this slide is telling you is that the big bar IMD1 is our patients who live in areas that are more deprived, and IMD5, the blue chart, is those patients that live in more affluent areas. And you can see here that the red chart means that those people who live in a poorer area are more likely not to attend a hospital appointment than those in a more wealthy area. And we're really concerned about that, and we want to close that gap. This slide is looking at appointments for people who live in prisons, and again you can see a big difference there. So the red is the prisoners, and the grey slide is all of us, and the blue slide is those that live in the most deprived area. So you can see again that there's a group, that's an inclusion health group. If you live in prison, if you've got connections with the criminal justice system, you're more likely not to attend an appointment. So again, an unacceptable inequality that we collectively need to be thinking about what are the solutions and how can we do something differently. We've been doing a lot of work at Northumbria to understand why people don't attend appointments, and we've been doing some pilot work, and we've been looking at navigation in certain pathways, and we've been introducing models where we maybe identify people who are less likely to attend, and we give them a telephone call and we speak to them. And some of the conversations that we've been having with patients have been really helpful, and they've told us an awful lot about how we can make it hard for people to attend. So some of those reasons are things like technology. They might not have a mobile phone, they might not be getting the text reminders, or they might not be able to afford to use their phone to ring us. You might be at work and you can't attend an appointment. You might not be able to be given time off work. You might be a carer. You might not understand why we're asking you to come. It might not have been explained, or the letter might be confusing. And we know that travel is a real barrier, and being able to afford a bus fare, you know, not realising that you can get your travel claims back if you're on certain benefits, etc. So you can see that, you know, there's a range of reasons, and the important thing is that we listen, and that there's a way that we can listen, and then there's a way that people can communicate why they need help and what that help needs to look like. And then these are some slides which just talk about like the pilots that we've been doing. So we ran a pilot in colposcopy, which is a gynecological service, and that again gave us a lot of information about things that we could do differently. And then lots of other slides which I'm not going to talk through, but we've, as a result of that, in our trust we've developed an inclusive, equitable healthcare model. And that's about a range of things that we're trying to embed in our organisation that helps people get to the care they need. So that's about training our workforce, using data and intelligence, reaching out to groups and communities that face more barriers and challenges, really thinking about things like poverty proofing, and how, as an NHS, if somebody's not got a lot of money, we can have expectations about people's abilities, and that's really not very helpful. So, you know, not thinking about somebody's financial circumstances. So we're doing a lot of work to be better at some of that. And then this is the way that we want to kind of embed navigation as a system. So a lot of that's around how do we work better with communities, with GPs, asset-based approach, with people like yourselves, then there's things that we can do as a trust, and then there's things that we can do as a business unit. So I'm going to just stop sharing now and then come back to the room. Stop sharing. Okay, so that just gives you kind of an overall view. I'll stop there and just if anyone's got any comments or questions, and then I'll put to you a bit of an ask or a bit of a discussion. Paul, hi Paul.
Hi Jill, yeah, my name is Paul Atkinson. I run a personal finance project for Durham County Council. I was just wondering what kind of activities or what kind of work you're doing with regards to personal finance, where financial barriers are stopping them getting to appointments and things like that.
Yeah, so we're certainly embedding the poverty proofing programme. So we're encouraging all of our staff to access the Boost training to raise awareness about poverty and the relationship between poverty and health. We've partnered up with the Citizens Advice Bureau, and we're about to have a welfare rights offer in our trust for patients and staff. And then we're doing a lot of work with MEC, making every contact count, so that as part of our MEC approach in the trust, staff can have conversations with patients and then again signpost people to help and support where they live, Paul. So our goal in our organisation and other NHS trusts is that staff have the MEC training and then use the Gateway app. And there is a tile on the Gateway app which is around financial well-being, and on that tile is information about where people can go for help and support. Does that answer the question?
Yeah, kind of. I was thinking about financial, specifically about what kind of financial activities you're doing or what are being offered to clients, so to speak. Is there any kind of workshops that are going on or being offered to them? Is there any kind of training around finance? And I'm not just talking about the kind of surface level stuff like a budget or debt advice and things like that. I'm perhaps thinking a bit more of a deeper level to try and get to the heart of what the problem is with finances, because this is what I find around County Durham, that there's a lot going on in terms of helping people navigate debt and things like that, but no one's really looking in depth at what are the causes of that. It's kind of a stick and plaster kind of approach.
And I
just
think
wonder if there's anything like that going on.
I think there is, and I think our role as an NHS trust is not necessarily to be providing it, but it's about signposting the person to where that's happening. So for us as a trust, it's more around the staff being aware of how they can get the person to the help that's available where they live. So I guess if we were in County Durham, it would be about the Durham Trust staff knowing about what you're describing for Durham, and making sure that patients were aware of that and had the opportunity to discuss that. So that's kind of the role of the NHS, is more as a kind of, I guess, a bridge between our services and the services in the community. And where they don't exist, I guess we would be talking to our councils and our voluntary and community sector about how do we fill that gap.
Yeah, that makes sense. I mean, maybe I should get in contact with the Durham Trusts and maybe have a discussion with them.
Exactly, and I think one of the things that I wanted to talk about this afternoon was that do you, in your roles, feel that you've got that link with your local trusts, and if not, how can we make that link a little bit stronger? So, you'll be probably having conversations with people in the communities, and those people will probably be telling you about some of the problems or the difficulties, and it's almost like, how do you then help us in the NHS understand some of those problems so that we can make it easier and help kind of think about the solutions.
Okay, thanks, Jill.
Okay.
Jill, I was just thinking that's a good piece. I think I've got a lot of colleagues on the call that can really help with the education piece, which we've just talked about, educating people what's available, because you only know what you know and you don't know what you don't know, do you? So I think we've all got a part to play with that. But again, if we can make sure what help and support is available that we are all as individuals aware of is in MEC, that can be our directory, and we need to educate then people in our community to be able to use MEC, to be able to access it themselves, how to access it, to signpost them to the provision and support that's available to them on there. Because if anybody doesn't know, please really look at the MEC site. It is fantastic. It's multi-languages. It's accessible. So it's a fantastic service. So we can have a look to make sure if you are aware of something that's available to you locally, have a look. Is it on MEC? If it's not on MEC, you can report it and get it built into there. If you think services are missing, you can contact myself. There's other colleagues. We can bring that to Jill and the team to see what we need, any recommendations of anything we can work off. So like I say, what Jill's asking is if you are aware of anything that's missing, or NHS as a whole can do to help and support you and the people in your community, to let me know.
Exactly. And things like, I don't know whether everyone's aware of things like the healthcare travel cost scheme. So patients who are attending a hospital appointment can claim back their travel costs, but I am aware that not everybody knows about that. And there's also things like the low income NHS scheme, so help with prescriptions, help with costs associated with getting your health needs met. And that's on the Gateway app. So in the finance tile, there's information on there. So I think I would hope that your role is about helping people know what's available to them to support. We haven't got a tile yet that's specifically about getting to a hospital appointment, but I'm hoping that this year one of our improvements will be that there'll be a tile specifically about help with getting to a hospital appointment or to support your healthcare needs. And once that's live, that will be a really useful thing on the Gateway app, that when you're having those conversations. And it might be that people are not in work because they're waiting for an operation, or they're waiting for help with whatever their healthcare needs are. So we need to check in with that person. Are you actually attending the appointments that you're being sent? And are you able to get to them? And we know from our conversations that some people don't come because they're a carer and they can't, leave the person that they care for at home, or they can't get childcare, or they can't get time off work. So it's about understanding and using your role to unpick some of those barriers. And then if there's a problem, how do you get in touch with us in the NHS so that we can help work together on the solution? And it's not simple by any means, but I think it's about those relationships and us working more closely together, like my teams with your teams.
Yeah. So I think thinking a solution for that with each of our areas is in DWP, everybody knows to contact myself and my team. But then when it comes to the Workwell colleagues, you've got your local delivery leads. We've got a couple on the call today. I know, Nicholas, I saw you were on. And I think if your colleagues, Workwell colleagues, are aware of anything, they can speak to that local delivery lead. And again, myself and the local delivery leads communicate. So have that communication chain going on, and we can feed that back to yourself, Jill, and other NHS trusts. Because I don't think, correct me if I'm wrong, anybody, but I don't think our PAS colleagues and possibly the Workwell colleagues in some instances will have direct access to people that can reach out to within the NHS trusts, Jill. So it's maybe using the who does. Do you know what I mean? Using the people who do have it.
Exactly. And going forward, I'm going to try and improve, have some kind of contact within each trust that your teams can link in with, so that there's that ability to have easy dialogue. Okay.
Yeah.
But I think today is that first part of us working that up, isn't it? It's just that initial discussion, and I don't even have a sense of if these topics come up in the Workwell conversations, or if if you're
I'll be quite honest with
exploring that. I just don't have any sense of
So I
that.
think this is a good time for that, because we know a lot of people we support have got multiple barriers going on in their lives, and financial struggles is one of those problems. Care, people have got health conditions, they're waiting for hospital appointments, and that would point them in the direction of the financial support they can get with those costs. So yes, I think that's a good point to bring up, Jill.
Great, brilliant. Tracy.
Yeah, I mean, you know me, and you know how I work. So I think, it's about the practical things. How do we start that work up? Would it be useful? So when we originally started this meeting, we wanted to know from all of our PAS advisors and work coaches, what is it they wanted in terms of training? Hence the reason why we set up the SharePoint area to try and park everything there. But I did send out a questionnaire to everybody. The response wasn't fantastic, but it was okay. It gave us enough information to tell us, what things you as PAS advisors and work coaches wanted in terms of learning. I wonder whether we could do quickly, just to, as a benchmark, send out, and we could, I can facilitate it pretty quickly by sending everybody a link out to a survey with just a few questions on about barriers. I think that would give us a bit of a benchmark, and then we'll make sure with some of the questions look a little bit deeper in how we can sort of improve
What
that
do you
as we
need?
go.
Yeah.
So I can certainly set that up in the next couple of
That'd be
days. That
great.
would be really quick
Thanks,
quick and easy. But
Yeah.
I would obviously ask the work coaches and the PAS advisors, to engage with this survey, because we need to know from you. It's it's not we need you to give us your thoughts. If I send a survey out, it'll be anonymous, so we don't need to collect your personal information. It would be useful to know whereabouts you are in the system, so whether you're in Durham, whether you're in South Tyneside or whatever. So we'll ask a couple of questions there, but this is anonymous, so you don't have to give us your name if you don't feel comfortable. But if you can give us some feedback, that would be great. I'll get that worked up, Jill. I'll send something across to you, just to check it, that we're asking the right questions, and we'll get that pushed out in the next week. I think that will give us some initial work with and something to take forward.
That would be really helpful. Thank you. And if anyone's got any questions that they want to kind of come back after the meeting or anything, and just go through Kay or Tracy, who've both got my contact details. But I think don't underestimate, I guess, your reach with people that really will benefit from the support that we're providing, and the insights that you gain will be really helpful in terms of addressing some of the inequalities that people in our communities face. So just please keep in touch, and if there's anything we can do to support you in your roles, which are really important roles, please let me know and let the team know. So thank you very much, and thank you, Tracy. And I've got to jump off now to another meeting, but thank you for your time, and we'll keep in touch.
Thank you, Jill.
Take care, everybody.
Thanks,
thank
Jill.
you. Bye-bye.
Thank you. Bye.
Bye, everyone.
Bye. Great stuff. Okie dokie. I think really that the rest of the meeting, I wanted to, offer time out to you as as people, as this meeting is about you, to give you a voice. So I want people to, or any little bits and pieces that they've got issues with, so we can fix them if that would be helpful. So I just want to open up the floor, really. Kay, I don't know if you've got anything. I know you're saying you're going to have to leave shortly.
No, I'm okay. No, I'm all right today. And today's meeting, it was the other meeting this morning. I couldn't join. So no, that's fine. So no, today is this meeting is meant to be for you as well. So I really want you to ask questions for our past colleagues. The data when it comes to the work well, it's still ongoing. So we're looking into that, and myself and Tracy are looking at how we can get more of the resources into the SharePoint page. So we are aware of these. So if anybody's going to ask about those, we're very aware of it, and it's an ongoing challenge, should we say. getting what we need with all of that. So back over to you though. Anybody want to share anything that's worked well? Celebrate, because I want to look at that as well. Something that you've done a bit differently that's worked really good. Or have you got any questions you want to ask? Haley, lovely, straight on there.
Hello. So
Hello.
I just wanted to share about Martin Harvey and his MBE.
Yes.
So
Some people
that
might
was
not know who Martin is, so
Okay,
give a
yeah.
bit of explanation, please, Haley.
Yeah, so Martin Harvey was the driving force really of PAS right in the beginning when it was in Durham Tees Valley. And he was part of the trial when it took place, and then in Durham Tees Valley we continued with it and the other districts kind of didn't. So he's been the driving force of that for around about 14 years now. So in 2023, he was actually awarded the Prime Minister's Award for his work on PAS and everything that he did. And then this year in the King's New Year's honours, he actually was given an MBE. He's not unfortunately on the call today because as usual, Martin is always full of busy. But I just wanted to shout that out and let everyone know that actually he's done an amazing job and he deserves every bit of recognition that he actually is getting because he's fantastic in the role.
Yeah, he's been the pinnacle behind all of this, hasn't he? And he's been the, should we say, the person on a pedestal everybody looks up to when it comes to what a patient advisor should be, because he lives, sleeps and breathes it, and everybody goes to Martin for an overview, a discussion, and he's so passionate about it, and he makes such a difference to people's lives, and yous all are doing that as well. So Martin's been in post doing this role for a lot of years, so he's got a lot of expertise behind him, but it just shows you get the right people in the right role to make the difference to those people. It makes such a difference, and being recognized for an MBE is absolutely brilliant. So Martin's done fantastic, hasn't he? Super proud of him. Yes. So thank you, Haley, for sharing that. Rightly so. Right, so anybody got anything they want to talk about, to ask questions? No, everybody's hunky-dory by the sounds of it. Nobody's got anything that they've done a bit different, or they've managed to really overcome a hurdle with somebody they're supporting, doing something a bit different that they could maybe share for to give food for thought for other colleagues. Everybody's quiet today, Tracy.
Never mind. Yeah, somebody said to me this morning it was Blue Monday, isn't it, today? So everybody's resolutions apparently have been broken by today. So anyway, never mind. It's fine. Obviously, you know, people are busy. We appreciate that, and people are still learning and still learning their new roles if they've just come into post. So, you know, we appreciate that. But what I will say is, you know, we hope to continue this meeting going forward every month. It is for you lot. But what I'd also like you to tell us is, what else do you want to know? What else do you want to hear from us? You know, I can invite colleagues in from, you know, from different parts of the system just to come and help you learn more about different areas to enhance and complement your role. So, you know, please drop us a message if there's any particular topics you want to know about or would benefit from having an expert to come and talk to us as a collective about certain things. You know, we're happy to do that. Whatever's going to make your life easier, you need to let us know by emailing myself or Kay, or drop it in the chat here. Just drop a one-liner in of what topics you're thinking about. But I'm not going to keep people online. If people are happy and they haven't got anything else to you know, that they want from here, we'll just cut this short. Go and get yourself a cup of tea or something, and we'll call it a day, shall we? Yeah, Kay, sorry.
Yeah, lovely. That's great. Thank you, Tracy.
Okay, thanks everybody.
Thank you, everybody.
Nice to see everybody. Bye.
Bye.
Thank you. Bye.